And welcome to Emphasis. The robots are coming, or shall we say they're here. Believe it or not, they're at an operating room near you. All of us want the best and the most innovative technology when it comes to our health and well-being. And today on our program, we have the privilege of having a renowned doctor from Christus Ochsner St. Patrick Hospital to talk about a new robotic surgical procedure. Help me welcome Dr. Matthias Nauts to the show. Thank you so much for being with us, Dr. Nauts. Now, when we talk about robots, people are thinking Star Wars or, some far-off type thing, but it's right here and now. What are we talking about with this robotic procedure?
So at St. Pat's Christus Ochsner, we have had the Da Vinci robot for at least 5 years now. And what it is, it's a robot that connects to the patient and is completely controlled by the surgeon. Mm-hmm. So the surgeon is in the same room as the patient and the robot, and we are basically able to do advanced procedures through little tiny incisions.
Wow.
So instead of having to make a large incision and put our hands in there, we are able to use the robot. And the robot has advantages such as 3D vision, and it has a wrist in the instruments. So we're able to replicate natural human movements.
Are you controlling it?
And I control everything. I actually have 4 different arms. So I can control the camera, I can control all my instruments, and I can do whatever needs to be done, and it's all under my control.
That is exciting. Now, is it any particular conditions or any type of tumors specifically that you're treating with this particular procedure?
We're basically doing anything in the abdomen. So gallbladder disease, which is very common, hernias, which are bulges in the abdominal wall. We're able to take out colon cancer, diverticulitis. They're also using it in urology, so they're able to do work on your kidneys. And the OBGYNs will use it as well. They use it in your pelvis and for hysterectomies and that kind of stuff.
So there are a variety of different diseases that you can conquer with this robotic procedure.
Correct.
Now, what are the advantages of it? You mentioned that it's minimally invasive, so I would imagine you'd have less bleeding. What are some of the benefits?
So the biggest thing is your return to life. So if you go and you get, let's say, your colon removed, you're going to get a big incision, you're going to be in the hospital for 7 days, and your recovery is going to be extended. On top of that, you're going to have a lot of potential for complications. Through having little tiny incisions, we can take out your colon, let's say in a 2-inch incision. Your hospital stay is going to be cut in half. You'll be back to work, back to life much faster. We're talking about weeks faster.
That's amazing. Less downtime.
Less downtime, yes.
How can people find out whether or not they would be a potential candidate? I mean, who is a potential candidate for this?
In the right surgeon's hands, anybody. I'm starting to do emergency cases. Basically, anyone who needs surgery can get it done. Not every hospital in this area has a Da Vinci robot. St. Patrick's and Lake Area are the only 2 that do.
Wow. So that's state of the art at your facility.
Correct. We have the latest and greatest Da Vinci robot.
What is the success rate that you've had with this type of procedure?
We've had very great results with everything. Our outpatient cases are all coming in. They're all going home the same day. And then our patients that have to stay, so let's say for colon surgery, we're getting them out 5 days earlier, which means that the patient is at less risk of getting infections. We're saving the hospital money and just better outcomes all around.
Wow, it sounds wonderful. Dr. Nauts, it simply means less complications for patients, less downtime, less bleeding, anything to make the healing process quicker and better.
Yes, ma'am.
So the Da Vinci robot at Christus St. Patrick Hospital. So we definitely want to get in touch with Christus Ochsner to find out more about the Da Vinci robot and see if whatever situation you're in, perhaps it can help you out.
Yes, ma'am.
All right. Thank you, doctor, for being with us. We appreciate it. Well, coming up next on Emphasis.